This conference will now be recorded.
Hello, everyone, and welcome to another peer-to-peer meeting with Region 4 in CCR&R. And this is a peer-to-peer meeting featuring Heidi Hotvedt from the Iowa Department of Public Health. She will be sharing a little bit about the updated childcare guidance, as well as answer any health and safety questions, hopefully, that you have for your program. I'm going to start here by just doing a little housekeeping. It's been quite a long time now that a lot of us have been home or been working virtually, at least in some capacity. So a lot of you know this, but I'm going to go ahead and remind you that the featured buttons on the bottom allow you to mute and unmute yourself, and then your camera button is there as well. We do ask that you remain muted, and then that means that red line is through it, and that will just help out with background noise. If you have something to share or a question for Heidi, you can go ahead and use the chat box that's in your upper right-hand corner. And I will be monitoring the chat box as she shares some information with us. So I'll go ahead and share out your questions, and we can do our best to answer them as we go. So today we have on with us Heidi Hotvedt. She is the Healthy Childcare Iowa Coordinator with the Iowa Department of Public Health. So Heidi, I'll let you go ahead and introduce yourself for anyone who might not know you, and then I will flip screens and you can go ahead and share your screen.
Great, thank you so much for allowing me to be on today and to present some information. So yes, my name is Heidi Hotvedt, and I work at the Iowa Department of Public Health in the Bureau of Family Health. And I coordinate the Healthy Child Care program as well as the child care nurse consultants statewide. So I was a local nurse consultant since 2007 and went through training actually in 2006 and worked as a local nurse consultant in Eastern Iowa for Clinton and Jackson County, and started in the coordinator position about 4 years ago, a little over 4 years ago. So thanks for having me on.
Yep, absolutely. Here, I'll go ahead and make you the presenter.
Okay, go ahead and share my screen. Shoot. Okay, just want to make sure if you can see my, oh, there we go. Okay, sorry, I had a little disconnect there for just a minute. So we already did an introduction, so I'm just going to get kind of right into it. And like I said, if you have any questions that, throughout the presentation, I know Julie's going to look at the chat box so she can kind of point those out, and then we can stop and just answer those questions. So just wanted to just review again our COVID case reporting and outbreak guidance document. So that document continues to be valid in terms of kind of the process for reporting those cases. So and both of our guidance documents, have been updated and are on the DHS website, as well as I know linked through CCR&R and also on our Healthy Childcare Iowa website. But both of our documents were updated this month in December with some of this change in guidance related to kind of exclusion criteria. And we'll talk a little bit about that, but I just wanted to review that the actual case reporting and outbreak guidance has not changed in terms of the process. So if there's a confirmed positive COVID-19 in staff or child, so if you have a parent call or a staff person calls in the morning and says that that they have a positive case, you do need to report if there's between 1 and 2 confirmed cases. So that first reported case to you would need to report that to your DHS licensing staff or your DHS compliance staff for home providers. And that's for each case that kind of comes up. So the reason that that's important to report that to your DHS licensing is they are tracking those positive cases, and also they will be providing them some guidance to you when that happens. And I know many of you have probably already had positive cases in childcare. I would say that's pretty common across the state. But it does become a little bit more, there's a lot more questions sometimes when there's an outbreak, and that would be 3 or more confirmed positive in a staff or child, and that's not in the same household. So if, say, if it's a staff person and their own child is positive and then one of their child, that would not be considered an outbreak. So kind of the same reporting. Again, you would contact your DHS licensing staff or your DHS compliance staff, and then Department of Human Services then will actually discuss with the local nurse consultant, reach out to the local nurse consultant, and also kind of public health, local public health gets involved in that. So the local nurse consultant may work for the local public health agency, or will have the contact person that is handling the child care questions at the local public health office. So reporting first to DHS and then working, and I know how it works. Sometimes you send out an email or you put a phone call out and you call both, because I know that, and sometimes it includes you call me or include me in the email, and that's fine. We just want to make sure that we're just following the guidance itself, that you definitely regulatory are required to contact your DHS licensing staff. But we're all here to help, and that's the whole point, is we really want to coordinate and help walk you through these questions, because it is somewhat confusing and each case is unique. Sometimes it's pretty straightforward when you hear about a positive case, and sometimes it's not. So that's a little bit about that guidance. And then, so just kind of reiterate that, so it's with the local nurse consultant following up with those case reports of 1 or 2 positive cases, then the reason they contact local public health is to kind of alert them that there is a need for some contact tracing. There's a process where that information sometimes takes a few days to get through, or a day or so to get through the system from when a positive result happens. So say a family member goes to their private physician and they have a test run and that test is positive. They have 24 hours to get that positive result reported to the state office, and then the state office then alerts local public health to that positive case. But as you can imagine, a lot of times, I will say, child care providers are the first to hear. Once the parent hears that their child is positive, or a staff person gets notification that they do have a positive COVID test, a lot of times it is you'll hear it first, and then you'll be reporting, like I said, to your DHS compliance person or to licensing, and then they would talk with local nurse consultant, or you may also talk with the local nurse consultant, and then that really helps to kind of provide that information. And really what the local nurse consultant provides to local public health is not specific information. It's really just your program and that there's been a positive case identified in a staff or a child. And then local public health then would follow up with whatever contact tracing is needed, which may include, possibly include your agency or your program. And so with those 3 or more positive cases, that's where kind of I come in and get involved as the Healthy Childcare or Iowa coordinator. Department of Human Services actually will let me know, and then there's some collaboration between the local nurse consultant and myself and state DHS, because we are tracking those outbreaks and making sure that we provide the guidance that's needed for the child care provider, so that we don't have continuation of spread in the child care environment related to the positive outbreak. So sometimes that means, we'll be, of course, walking through identifying, who would have been exposed to that positive case, and what the next steps would be in terms of exclusion criteria, cleaning and disinfecting that area where the positive case was. So a lot of those questions, continuation of monitoring for when that child or staff person returns after their exclusion period. So it's just a chance for us to kind of walk through that with you, and that a lot of times will be your local nurse consultant or myself as the Healthy Childcare Iowa coordinator. So the next thing I want to just visit with you a little bit about is the child care guidance document. And actually I just see an error here, and I just want to I just want to point this out. So this is not just encouraged, but it's required. And just want to make sure that you know that that's an error on the screen. I just noticed that. So face coverings or masks are actually required for staff and children. And that is well, not required for children, I should say. Required for staff when the mask mandate came out for the state. And then also, you know, we do encourage for children. For older children, we really feel like that is workable for most programs. What I am hearing is that that is working quite well for programs to have their children have masks in place. And we really want to make sure that you know, that masks do help to provide some protection against exposure to a positive COVID. And so, you know, using those masks in childcare for staff and then also for children that are, you know, of course, if they're, you know, 2 or older, then they can be wearing masks. And I know that sometimes those 2 to 3-year-olds is a little bit more difficult for those children because of consistently keeping that mask on and not pulling that down. But what I'm hearing out in the field is that children are actually doing quite well with wearing masks. I think that's becoming more commonplace across the state and of course across the United States, that children are wearing masks in the school and childcare setting. And so we've really been hearing some good things about what's been going on while those children have masks in place. Staff, I know that we have some questions sometimes of what about a person who can't wear a mask or a child who can't wear a mask, and that's going to be our policy. How do we handle that? And so we really just want to talk about, you know, if there's somebody that has that can't wear a mask for maybe some issues because of respiratory condition or a reason that they can't wear a mask in care, then you definitely need to have that documented because that is a policy then you would want to be following, and then making sure that that is documented as to that you're aware that they're unable to wear a mask because of that. Some programs we don't have in policy that it's required that you have documentation from like a physician. However, that is your policy as program directors and owners, that if you put in your policy that you wanted that in writing from the physician, you could put that into your policy around mask use. I think that's sometimes a challenge, you know, especially for children, if that's a requirement to require a parent to have that in writing from the physician is, you know, kind of an added precaution, and sometimes can be really challenging for families to get that documentation from their physician. So I think that just walking through those policy changes with your local nurse consultant can really help to kind of, you know, decide how you're going to put that into practice and what you really want stated in your parent guidance related to if that's something that you're going to put into it as a policy, as a requirement. And then that's the other thing is I always like to, on the childcare guidance, there is a link that talks about the Iowa Department of Public Health guidance related to wearing masks. And we do know that, you know, we are going to have kids and sometimes staff in care that do not have a mask on. But if everybody else is wearing a mask in that classroom, it's really helping to protect the full classroom somewhat because the masks are being worn by other individuals. And so the person that's not able to wear a mask could potentially be, identified as needing to be excluded if they have an exposure to COVID-19. But that is something that, you know, if the whole classroom has their masks in place, that really is just that one maybe individual that isn't able to wear them. We've had some questions about the clear masks, and really clear masks are great for, especially I just think working with young children, but this is just some information that came from the CDC, is that definitely with the Disabilities Education Act, that they're really saying if a student or staff is deaf or hard of hearing, that it's best to have clear masks so that they can visualize the mouth movement for lip reading. Also just helping young students learning to read and communicate. a clear mask panel, and I know there's a lot more on the market now. I think initially we were struggling with some of those things, but I've just noticed that there are a lot more companies that are making the clear mask panels for staff to be able to wear. So that's something that you might think about looking at and having staff have those in place. And then, of course, working with students or children with disabilities, having that clear mask is helpful so that the child can see the person's face and can see the smile and the emotion and all of that in their clear panel on their mask.
There are a couple questions, Heidi.
Yeah, I was going to take a quick break here. I was thinking there was maybe a couple questions, so I just wanted to take a break.
Yep, and I know that you kind of talked a little bit about what is needed if a staff member or a child needs to or is unable to wear a mask medically. So you talked a little bit about a doctor's note. Is there like a specific form, or it's just any kind of documentation from a physician?
There isn't a specific form. I know that some programs are wanting to have kind of like almost like a prescription or an order that says from the physician that they would write that out and sign it, that the child or the staff person couldn't wear a mask. But that's, is really the policy related to the actual specific child care program and what they've put into place in terms of what they'll require. There is not a recommendation by Department of Human Services or Iowa Department of Public Health, or actually CDC for that matter, that you would have a written prescription or order from the physician if someone wasn't able to wear a mask. And we really don't want to make things cumbersome for families. That's the thing that I think is concerning for me, is that some of those, having that as a requirement could really be challenging for a family member, especially if their insurance wouldn't pay for a visit and they end up having to pay for a visit to the physician to actually get that in writing, or if that's something they could handle just from the front office with that physician. And each clinic is unique that way. So I just hate to say, that's just something that I think you need to work through in terms of what your policy would be.
Absolutely, thank you. And then going back a little bit to the contact tracing. So if someone were to test positive at Test Iowa or their doctor's office, who exactly is notified? So this person's been exposed a couple times, but has never been contacted by anyone except for the person that tested positive.
Yeah, so there's a process for contact tracing for Department of Health, so that could be at the state level or at the local Department of Health. And each we have some contact tracing actually being done at the state level right now, but also we have some that is being done at the local level. So in general, that report has come from the lab. So when the lab has the test that's positive, and very similar to any other reportable diseases that are part of our process. If a child has an influenza A, a report that is from their swab taken and that's reported to the lab, then that's reported to the State Department of Health, and then that is actually then those names or that information is sent then to the local Department of Health. So those contact tracing is done from there. Now, we do know sometimes when you're, and as you can imagine, if you were to start feeling ill today and you went in and you were tested, so think about this as yourself, and then you had to go back and figure out who you had contact with in the last 48 hours, it's very challenging when you're out and about. And I know contact tracing can be very challenging just to actually get contact of all of those people that the person who was positive was in contact with, including even in childcare. And I know that there's been some, just with talking with Department of Health, that some of the contact tracing has been going very well and streamlined, and then some has been a little bit more challenging when they don't have phone numbers, or sometimes their phone number is blocked when they call. So just so you know, if you get, I'm just going to put a little plug in, if you get an unknown number that pulls up on your cell phone, or if you have a number that maybe looks, spam-like, still answer it. And I know that was really challenging during the election period because we had a lot of those kinds of calls. And if you're like any of us, including myself, sometimes you ignore those calls. But I'm just going to say, we actually were told this at one of our last meetings at Public Health. If you get a number that is called, especially, you're not expecting, please do answer it because it could possibly be a contact tracer trying to get a hold of you. So, I'm just going to put that plug in for your local public health. And then, we all know there's a lot of telemarketers out there. So a little bit challenging. Yeah.
Okay, and then another question, if a child has COVID symptoms but has not yet tested positive, we know that the child should self-isolate, but do their asymptomatic siblings need to also isolate themselves until they get a result back from that COVID test?
So you said that the child, though, tested positive or just was pending?
Has symptoms, but has not tested positive yet.
Has symptoms. Yeah, so our guidance document is all around, we really don't look at families, we look at parents or the caregivers of the child. We look at the child and we look at staff. So we always say that if a child is ill or if their parent is ill, they need to be excluded. And that's, we've always had that with the child, but not necessarily the parent in the past, but we're asking that a child be excluded. And then if their tests are pending or if they choose not to test, then we would have the child then need to be excluded for, for the 10 days. I mean, that's kind of if they're ill and we don't have a specific diagnosis of what they're ill with, that they need to be excluded for the 10 days, be fever free for 24 hours. And that their symptoms should be, pretty much resolved before they would come back. We do not exclude siblings in that, situation because we really don't know what that child has. Now, I have, if the child then is tested and they're pending, and the reason that we really point out parents compared to or the caregiver of the child is we do know for siblings there may be exposure, but every family situation is unique, and so siblings do not usually give hands-on care to the child or are the ones that are actually probably involved in the child's illness or needing if they're needing help. And so their exposure is not the same as a parent or the caregiver or the grandparent, to someone that's actually caring for the child in the home. So we really look at our guidance documents are based on positive results, or if the child's pending, they need to not be in care, but we don't exclude the siblings at that point. So
great, thank you. That makes a lot of sense there.
Great question.
And then one more, what are the most common symptoms for seeing COVID in a child? Is it, kind of the same things? I know it kind of varies a little bit.
Yeah, actually, there's some data, it's preliminary data, but some national data on symptoms that are common. And unfortunately for children, the most common ones are kind of the, what we'd almost say like the cold, flu, runny nose, cough stuff. Definitely fever is definitely noted in children. And there's a lot of co-infection with COVID. So that we have some national data, and like I said, it's preliminary, but it's data around children that are positive for COVID, but also positive for something else. And what they're positive for is those other upper respiratory infections. So they specifically named some of that upper respiratory type things like, with like a sinusitis is one that I know that they've identified. Strep, actually streptococcal, infection has been identified as a co-infection with COVID. So we are seeing some of those trends with children.
Thank you.
Yeah,
that's great. All we have for now. So you can go ahead and move on.
Yeah, and I actually might, let's see what I just want to Yeah, I just wanted to kind of just a little bit more about some things about, I know we've had questions about face shields and mask storage, just a little bit more on masks. So because, and I think everyone maybe has, they're having some, they've kind of worked through some of these issues, but I do still get questions about masks and face shields. So if using a face shield, the CDC says that the use of face shields shouldn't be used just alone. They need to be with having a mask in place. And we have that question still frequently come up. And then storage is probably the most challenging question that comes up. And I would say, that's a great time to really work with your local nurse consultant or your local CCR&R consultant, because they're familiar with your actual space and they kind of know your layout. But I get this question some too, so I'll throw that out there, that really they really say to have a separate container. So and putting that in kind of a personal space, locker, cubby, shelf, whatever is kind of that child's designated space that they're putting their items in. And so, that's a logistical challenge. And I'm just going to be honest with you, because when children take their mask off, then we want people to be 6 feet away from them when they have their mask off. So as you can imagine, if you're all going to your cubby at the same time, you're all within 6 feet. And if you're all taking your mask off and then you're going to maybe walk over to go, go lay down, for rest break, then you have everybody without their mask off in the same space. So that's where really thinking about, okay, so when a child is maybe sitting at the table ready to eat, similar to if anybody has done indoor dining, you're expected to have your mask on the whole time until you actually start to eat, and then you take your mask off. So could you have, and in my mind, I think, a little, plastic container that could easily go through the dishwasher or be sanitized would be best, because I know I've had people say, well, we've tried plastic bags or paper bags, and we don't want plastic bags, because that's a risk for children, and then paper bags, we're just going through them because they get damp, because the masks are damp. So there's all those things. And so in my mind, I think a container that's plastic that could be run through either the dishwasher or be used your disinfectant spray on would be ideal, because you're going to be reusing that piece. And I think we're going to have masks in place for a little while. So I know that I just saw on the news at lunch that the University of Iowa just had their first vaccinations that happened with healthcare providers. So we do have vaccine already being administered here in the state of Iowa. That was pretty exciting. That was actually highlighted on the national news. So we do have vaccine that will start helping with some of our numbers, but I do feel like we will continue to wear masks. So thinking of where can you have your containers and how can you keep them, labeling them is very important, to have them labeled, having them sit by the child, at the table, that would be great. I could envision that they have their container and that they maybe bring with them when they go to lay down on their mat, and then they can put their mask inside the container while they're resting, because we don't want them wearing their mask while they're resting. So just thinking of your space, but those are some ideas. I know that lanyards have been something that have been discussed. There is a concern for strangulation hazards, and that's something that that has been identified as a concern. And even the breakaway type, and the reason is the breakaway type, once they're hooked to the mask, is still could possibly go around the child's neck and be a strangulation. So that's a concern with lanyards. Trying to work through that. I know in the school setting, a lot of lanyards are being used where they clip their mask on the lanyard. I'm not sure in childcare if that's really a best practice. And then cleaning is an issue for lanyards. I'm just gonna be honest with you. I don't know how you clean them, because they're really not, and they're, of course they're touching the mask, so they really should be cleaned and disinfected. So some things to really think about when you're thinking about masks. I saw a couple maybe chats pop up, So I'll stop there.
Yep, a couple things. So someone said that she's hearing of parents that are testing positive, but then not isolating from their children. So she just wanted to check if that would affect the date that children can return back to school or care.
Yeah, so I was actually, we can talk a little bit about that. So we do have the guidance, and the Centers for Disease Control continues to say, 14 days of quarantine is, best practice is recommended for an exposure. And so, in the past, actually, the CDC had, until about last week, they had calendars on their website where you could actually see, okay, here the parent was in their isolation period for 10 days, because that's maintained the same, that you have 10 days where you're isolating when you have been a positive COVID-19 case. And so then the child, if they never, if they were in the parent's, location, they were within 6 feet of the parent, throughout their infectious period, that they would then start the 14-day exclusion starting from the day that the parent, so day 0 basically, or day 1 would be the day after they were released from their isolation period, and then you would count 14 days from there. So as you can imagine, that's 24 days. That is very challenging. So I think being upfront with parents that is a concern. And I would actually even, it's very readily available on the CDC website as well as the IDPH website. However, if parents haven't heard that from you personally or seen it in writing in your policy, they may not believe that would be an actual situation that would occur. Best practice would be if the parent could possibly isolate away from the family. We know that works in a dual parent or a dual family of caring, caregivers in the family. That doesn't work for a single parent unless they have someone who can come in and help care for their child while they're ill and they can stay away. Every family is unique, so I think it's really important for us to have conversation with our families about that. But we do have some guidance now that we can have exposed individuals come back into care or into the workforce sooner than the 14 days. So I'm going to talk a little bit about that because that was updated in both the Childcare Guidance and our case reporting document. So there is an option for a 10-day. So if in those 14 days, so you're basically under quarantine for the 14 days. So say you had an exposure for a child or a staff, they would still be considered 14-day quarantine. However, after day 10, so not day 10, but after day 10, then they could return sooner if they have not had any symptoms. So if they're not showing any symptoms, they've been doing well throughout the whole quarantine period, they could come back sooner to work. However, when they come back, they need to have a mask and they need to maintain 6-foot space away from others for those last 4 days. So it's not forever. The mask would be, of course, because we have a mask policy in place. But so that's a little shift for us. And then if they were wanting to return 7 days, so after 7 days of quarantine, then they would need to be tested, and they'd have to be tested on basically day 5, day 6, or day 7. So they need to have their test result. It needs to be negative, and they could return. So then they have to also put in those mitigation strategies of wearing a mask and separating 6 feet from others during the rest of that quarantine period, which would be another 7 days after that 7 days of quarantine. So that could work for staff probably fairly well. For children, that would be challenging. The 6 foot is probably the most challenging, and then it's not going to work for infants and toddlers because they can't wear a mask. So that's been some, I think, a little bit of misunderstanding, a little bit of challenge there, but that was, we did clarify that with Department of Human Services. So, and I think I have a question here, so I'll take that.
Yep, one more question about the vaccine. So we know that that's pretty early and that healthcare providers are probably going to have access to those first. Any word on when childcare providers may be offered a vaccine?
Yeah, childcare providers, we're really not sure where they're at. There's kind of a tier system of administration, and that's something that is, I know that Iowa has looked at in terms of who would get the vaccine first, and that's starting with healthcare providers, and then I know that they're going to be looking at emergency personnel, so those hands-on, providers that would have exposure, and then also nursing homes I know are at kind of the top of the list for vaccines. So I'm not really sure where childcare and the general population will end up in terms of those tiers of vaccinations, but something that definitely the childcare industry has been brought up. So it's not that we haven't talked about, but we just don't have a date of or a time frame of when that would be. But that has been brought up that child care providers would be in a tier of, because we know you're essential workforce, even though I know you're not on the official national list of essential personnel. And then this is something that a lot of parents and families and providers may not know, but the current vaccine has not received the testing with the testing for children under the age of 18. So the vaccine right now that's being distributed is for 18, I think it's 18 and older, okay? So younger than 18, it has not had that authorization. Now, I'm not sure, what I saw nationally is there is some trials going for some younger population, but I'm not sure if it's going as young as our child care kids at this time. So I'm not sure where nationally they're at with that. Good question.
Great, that's all we have so far.
Okay. Let's see. I was gonna show a screenshot, but I might have to.
This is one of our left here.
Okay. I'm having a hard time with sharing. I was going to share my screen to something else. I need to probably minimize this screen?
Yeah. I don't know if you hit escape, if you can, get out of the presentation mode. There you go.
Yeah, I was just gonna. I'll show this screen here real quick. So this is still linked to the Childcare Guidance document, the one that was updated on December 8th, and I know that was all sent out by Constant Contact, but if you haven't seen the updated Childcare Guidance from December 8th, that is linked on the DHS website. But it still links to this document, and this I think is really helpful too about kind of quarantining and when people are wearing a mask. And this is kind of regardless of kind of this updated guidance of having a shorter quarantine, but just in general, the good scenarios. Oops, I just went back. Sorry about that. The one thing I just wanted to kind of show is that, when everybody's masked, if there's a positive COVID person, that person isolates. So this is where this can really be helpful in your programs. If you haven't started having children wear masks, this would be really helpful. So when case reporting is done or contact tracing is done, and say a positive individual, so say it's a child or a staff that is positive and they're in a group setting, if everybody had masks in that group setting, so the other staff in that room had masks on, the other children were wearing their masks consistently, and even at the table when they didn't have masks on during lunch, they're spacing kids apart from each other. Or I know some programs that are doing kind of a shift in how they serve meals, and they're going into maybe a different room where they can space kids out at ends of tables so they can space them out the 6 feet. So when they're eating, because we know we have a 15-minute window that we look at for when they don't have their mask in place. So those 2 times that are going to be the most challenging are during meals and during nap. And so can you think of a way to make it work in your system, in your program space, to space people out during naps and during meals? And if you can, then if everybody's masked and that person who's positive isolates for those 10 days, everyone else is considered they're a contact. But since they were having masks in place the whole time consistently, when they were around that positive person, they do not quarantine. They self-monitor, so we would continue to have them self-monitor, but they do not have to be excluded per our exclusion guidance. So that is really huge for programs, for families, for your business, to really think about how can I make this work? Because the other scenarios, and then I'll just kind of say, you know, this little box down below, and hopefully you guys can see this okay, but so, you know, there again, if somebody who, you know, say a staff person, they started developing symptoms and they had a positive test. So maybe everyone in care, you know, and I'm thinking maybe a home provider, you know, everyone in care except for maybe a couple of toddlers and the infant didn't have a mask. Now, those children are going to need to quarantine because they had exposure to the positive case. But the rest of the group, including the provider who had their mask on, would be monitoring but not required to quarantine for, you know, whether it's 14 days or 10 days or 7 days. It doesn't really matter. 7 days is just as hard. I mean, as 14, it's quarantine. So just really trying to work through that. And that's where I feel like working with your childcare nurse consultant on your policy around it, talking with your CCR&R consultant about your layout and your space and what I can do with masks and where am I going to store them and all those things. And how can I space my classroom so that I have kids separated during their nap time when they don't have their mask on. That is really what I would suggest as would be a helpful thing for programs to do if you haven't started putting that into practice yet. I hope that's kind of helpful to talk about that a little bit. I'm not seeing any other questions right now. So couple, I'm just trying to think of just one thing I was going to say is the CDC having those calendars that they had for quarantine. That's not on the website right now. Now they still have some basic guidance that says, you know, it's from the last exposure to the individual. So we do still say, you know, when you call either your DHS consultant, your nurse consultant, or myself, we'll definitely say, okay, who was the positive case? When were they in care? And then we say, who were they exposed to? Who did they expose in that group? Who were the close contacts? Were any of them wearing masks? And then we look at 48 hours prior. So if it was Wednesday that they started developing symptoms, they tested Wednesday afternoon, or they tested on, Thursday, we go back from the last day they were in care and then 48 hours prior to that. So we look at that whole group. So, and I think we've done pretty well where we're not running into a lot of challenges with staff members because everyone's wearing masks, but we have had a lot of questions when it comes to children. I can hear some busy kids in the background. Sounds good. I like to hear busy kids.
Yeah, right. I miss going out to the programs too and seeing.
So do I. So do I.
Okay, so there is one question about can you explain the difference in the different types of testing, like antigen or PCR testing? Some of those I haven't even heard of.
So an antigen test is actually a blood test that is looking for if you have developed antibodies to COVID-19. So that's where somebody who has maybe had symptoms, didn't get tested, their symptoms were 3 months ago and they weren't tested, or some of the cases from the early beginnings of COVID, especially last winter, we had a lot of people that really, we didn't have testing widely available. I mean, now tomorrow you could go get a test and you'd be able to test because it's readily available, statewide. But there was a time when testing wasn't as readily available, and so we had people that had maybe symptoms or felt really ill for maybe 2 weeks, and they never knew if they had COVID-19 or not. And we definitely have some guidance around if it's in the last 3 months. We know there's kind of some protective factors available to that person if they get re-exposed. So we have individuals that are going and requesting from their physician's office an antigen test, and then that's what they would be doing, is a blood test to determine if there was antibodies present in your system that showed that you did fight off COVID and had exposure and was, potentially you would have been positive if you would have had a test back when you were exposed. The key thing on that is if you're looking at getting antigen testing done and you feel like you had been ill, if you could go back and figure out the dates and kind of when that period was, that's really helpful for the physician to know. And then for the different types, there, all of the tests that are being done in the state of Iowa go through a process to be approved. So we have some tests that are being done through the Test Iowa. We have some tests that are kind of the rapid tests that some local clinics are using. I know that Test Iowa does the PCR test. We have the saliva test that is available in our state in some areas. We have the kind of that quick test, that rapid test that we do, and all of those are approved in the state of Iowa. They go through a process to go through approval so that they're accurate. We want to make sure that tests are accurate. Now there is, I think, a risk with any test. You could potentially have a false, I'd say probably more false negative. And the reason that happens is sometimes you're testing too soon and you haven't, and I've actually had that happen in a couple programs. So I'm just going to just share this information. We had a situation where a program had called and said that the staff person had not been feeling well, went tested and had a negative test, and then came back to care the next day because they had a negative test. Unfortunately, the person was still having symptoms. And then the following day, they started with a fever and feeling much worse, and then went in and were tested again, and that test was positive. And what the physician said was probably they tested too soon. And that's one thing where, there is kind of a window of when your body will actually start producing what they call viral load, or the viruses in your system. And so if you don't have a good viral load, sometimes a test will not test out just yet. And so you'll have they don't really call it a false negative, but it would be a negative result, and then a day later you're positive. And that has happened, and I've had phone calls about that. So going back to that situation that I consulted on, that's why we say if someone is ill, they need to be out of care. And if they have a test result that is negative, they should, they need to be 24 hours fever free, and illness symptoms have resolved before they return. And I think sometimes people just hear the 24-hour fever free and they didn't have a fever, so then they come back the next day. But a lot of times they still have symptoms. So giving it a day more, they might feel, much worse by the next day. So I would just say that's something to be aware of. Now, if everyone's wearing masks, there's a little bit more of a safety net there, because then if they were to become worse and they went and had, and went home and then were tested the next day and were positive, then you'd still be going back, looking at the 48 hours of exposure and who was exposed. But with this scenario, if everyone, had their mask in place and you had good spacing for the times when they didn't have their mask, then they would all be needing to self-monitor, but they would not be excluded from care.
And then just another follow-up kind of along those lines. So the DHS guidance says that persons who test positive for COVID-19 on a serologic test should not be excluded unless they also test positive for COVID-19 on PCR testing.
So yeah, that's the serologic test would be the blood test. So we're looking for antigens. So if somebody tested, and that we have had, I've heard of a few cases where somebody was positive and had antibodies, but then they got it a second time and they don't really know. I mean, that's rare. They're not really sure. There's not enough data or research on that yet, but we have heard of some situations where they feel like a person has had it a second time. So I'm not sure, what that's going to look like in the future on that, but that's something where that's where that guidance, if that makes sense. So if you test positive for antigens, but you're not ill right now and you're not having COVID symptoms or a repeat of the illness, then that just means that you actually have tested positive for serologic testing, blood testing, that you have antibodies in your system. Good question. That's a little, I know some of these things with the guidance document, I'll tell you, you got to walk through them.
Yeah.
Because it's a little confusing, I know. And we try to make these guidance documents as readable as possible, but we do know that there is some language that is very medical health related to all of the COVID information. And so that's good questions. And, reach out to your local nurse consultant or reach out to me. You can always email me. My contact information was at the beginning of the slides, and that's on the Healthy Childcare Iowa website as well. So you can always send an email to me and I'll try to walk through that with you, or call.
Thank you. We appreciate that.
Yeah.
So where could someone go just to get antigen testing? Could you just go and get tested for the antigens if you wanted to?
I know that there's different places out there that are available, and I think more they're adding more. So I would reach out to your local healthcare provider first and say, is that something that you're offering? Or if you have a local lab that you usually work with, you could call that lab and find out if they're doing antigen or antibody testing.
Awesome. Thank you. And then a comment from a provider. She said she just had her first parent test positive this morning. The parent didn't have any symptoms and was exposed at work. So the parent did rapid testing and she was negative. But the child did end up leaving care, and then she followed up with her DHS licensing consultant. So I think she's wondering if you had any guidance for her or any staff members that are still there today at the program.
Could you repeat that? I'm sorry, I lost sound for just a blip, and I didn't catch the whole thing. So.
Yep, sure. So she just had her first parent test positive this morning. The parent did not have any symptoms, but was exposed at work. And then she did get a rapid test, and then the parent was negative, but the child was in care today and then did leave. So she didn't know if you had any guidance around anyone else still there at the program.
Yeah, and that's something that I guess I'd like to, is that something that maybe you could send me a quick email and we could walk through that a little bit so I have enough information just for exposure. Since it's a Monday, I'm assuming that we don't have to be concerned about the 48-hour period prior to, but I just want to walk through that because I know each program is unique.
Awesome, and that's it for now.
Okay. That's pretty much all I had for kind of updates and guidance. I will say that, if you haven't, I'll go to that. Let me go to that screen real quick. I just want to kind of show our website and stuff, but I know all of you, hopefully have been, oh, I'm having a challenge with sharing. Okay, stop sharing. There it is. Can't find my button. I was just trying to find the button there. How can I stop sharing?
There you go.
Oh no, it's sharing again.
Here, nope. I'll just take, are you done sharing all the way, Heidi?
Yeah, I was just gonna see if there was, I was gonna try to show my, I don't know why I'm running into challenges today. with my screens, but I'm freezing up a little bit. I'm sorry. I was going to just show our website link, but that is definitely, if you need that information. I know your first screen showed our website, which is Healthy Childcare Iowa. You can always reach out to your CCR&R. Thank you so much for bringing that up. So the Healthy Childcare Iowa website, and that's right at the Department of Public Health. And then in the printed products section is where we have our COVID information. So there's a lot of helpful information. So you can see on the tab under printed products. And if you haven't been on our website before, this is the area where we have everything you can print off and download for your programs. So everything from action plans to what if I have bed bugs in my childcare, or head lice brochures on there. But we have a COVID section. All of the health forms are on here. Updated. We updated our med forms, those are on there, but we have a COVID section and we have our guidance documents posted on there, and then some additional links. I think that's probably been the biggest challenge. I've had a lot of programs say, you know, I'm trying to find this and I can't find the right link. And I think CCR&R is doing a great job with putting that on their front page. We've put it here because this is the most commonly this is the common page that everybody goes to for childcare providers, is the printed product section. And then the Iowa Department of Public Health, you know, if you just Google on their website, but sometimes the childcare information is a little buried, and so is on the CDC, the childcare information is a little buried, and then you're in the weeds trying to find what you're trying to look for. So please reach out to your consultants, because we can just find it quick if you need it and send you the link to it. I think
absolutely. It was just a comment from a provider. She just had some tips on how they do their masks at her program. They use baskets by the cots, so they're able to sanitize the baskets in the afternoon when they're done using them. And then they have used command hooks on the chairs so that when the children are eating, they can just hang their mask on the back of the chair, and then they can just easily clean that chair with the disinfectant when they're done eating. So
I love it. I love when people have these helpful hints. I talked to a program, I know a couple programs that are doing kind of the picnic style. So I actually had a conversation last week with a program, and I said, I'm going to share something that somebody else shared with me, but for those 4 days, because they were going to have kids come back early and self-monitor from a whole classroom, so they didn't all have to be out for the full 14 days. And so she said, well, we've figured it all out. We're just going to put a towel down on the floor, and we're spacing them around 6 feet, and then each child's going to have more like a picnic for lunch and for snacks. And she said, and we're not going to serve anything really problematic for the next 4 days, so that it's not as messy. And so that's how they were figuring out their their spacing with coming back a little bit sooner. So I think I love that when people share their ideas, because you guys are the experts. We are not when it comes to childcare, and reaching out, like I said, to your local nurse consultant and your local CCR&R consultant. They know your program, so sometimes it just helps to say, oh yeah, I know you have that classroom and that's how your setup usually is. Maybe you could do it differently, and then walking that through to kind of help you problem solve. So great.
Yes, absolutely. I love the sharing as well. It's nice to hear providers engage with each other and share ideas, for sure. So thank you for attending our meeting. It looks like we used up just about all the time, so that's great. We hope that we answered the questions that you have. If you do have questions, you can always email Heidi, and you can always email me. If I don't know the answer to your question, I will reach out and try to find the answer for you. So my contact information is also on the slide, and I will send out the link to access this recording via email. That way, if you would like to use it, view it again for reference, then you're able to do that. But yes, your child care consultant and your nurse consultant are also really good resources, so make sure to utilize them, and you can contact us at any time if you have any questions.
Thanks, Julie. Thanks, everyone.
Thanks so much, Heidi. Yep, thanks, child care providers, for being on with us today.